Mahoney, I'm the operations manager, and a quick run through the agenda before we start. So Professor Kenny, our PI, will make some welcoming introductory remarks, and we'll move to Minister Butler's speech to launch. Then we'll have three presentations. Dr. Aisling O'Halloran will talk about healthcare utilisation, frailty and multimorbidity among the older population. I myself will talk about internet access and use rates, and Dr. Christine McGarrigle will talk about the contributions of the older society, the contributions of older people to Irish society. And without further ado, I'll move to Professor Kenny for a welcome.
Thank you, and you're all very welcome to the launch of this unique topic this morning. It's a detailed view of what people over the age of 50 in Ireland looked like on the eve of a pandemic, something we could never have foreseen at the time. I want to thank everybody for the attendance, but also I'd like to take this opportunity to publicly acknowledge the amazing work of the team in TILDA, and particularly the senior management of the team, Paul O'Mahony, Anne Heaver, Lucy Dugan, Niamh Clark, Orna Donoghue. You'll hear from the other researchers, etc., who were involved in this report, but very often those hardworking senior management are behind the scenes and not acknowledged. So thank you for the opportunity to acknowledge them. The value of today's report, of course, is going to be, it sets the scene for how much the pandemic will have affected, altered, influenced the lives of older people in Ireland. And when you hear some of the data with respect to how common frailty is, or multimorbidity, or the lack of internet access for people over the age of 75, for example, or even smartphones, and the most important, the huge contribution that older people make to our society, it gives us an opportunity to pause and reflect on the interventions we took in the context of the pandemic. And now that we know so much about the cohort that we were influencing big time by those interventions, maybe we may change our practice going forward, given that information and given the wisdom we have now. But of course, then all of this was so new and day by day so terrifying. I particularly want to thank Minister Butler, who is the Minister of State in the Department of Health. She's a particular focus in her portfolio on mental health and, of course, on older people. And both of those are very, very pertinent in the context of today's pandemic. It's very encouraging for us as a team to see the department's interest in and support for the TILDA study. And ironically, the pandemic has given us an opportunity to, in the interim, once March 12th hit and we were confined very much to our activities and had to stall our wave 6, which was a really detailed health assessment wave that we were required extensive face-to-face contact with our participants, we repurposed ourselves, every single member of the team did, to produce information, even at local authority level, derived from the TILDA sample, so that we could assist in the provision of health services and social care services, etc., providing data that local authorities and others needed to make those relative calls on limited resources. I would also like to thank our funders. Of course, the Department of Health, our principal funder with whom we work very closely. Atlantic Philanthropies started off the funding on this study, and their investment and that of Irish Life leveraged a lot of other support for the study. And I reserve our final and sincere thanks to our participants. We have an amazing group of participants. They give up so much of their time. Our response rates in Ireland are the highest in Europe for a study of this kind, and they're giving so much more back to the society in Ireland. So thank you to our 9,000 odd participants who started out this journey with us. We are now 10 years into the collection of the TILDA data set, and that 10-year anniversary, 2018-19, was on the eve of the pandemic. So without further ado, I would like to hand you over to the Minister Butler, and again, thank her very much for sharing this morning with us.
Thank you very much for that invitation. It is my great pleasure to have been invited to launch the Wave 5 TILDA report today. As Minister of State at the Department of Health with responsibility for mental health and older people, I am well aware of TILDA's invaluable contribution in building up a longitudinal picture of the health, the economic, and the social circumstances of older people over the past 10 years here in Ireland. This is in itself useful, but the real value in this research lies in how it assists policymakers and programme planners to better understand ageing in Ireland over a sustained period of time. The Department of Health is very supportive of the work being done by TILDA and sees the significant benefit of having a nationally representative longitudinal study on ageing. This is why the department has granted 22 million to the conduct of the study, covering the period from 2006 to 2023. Today marks the launch of the 5th wave of the study, with a 6th to come next year. Ireland's population is aging rapidly, and the rate of increase is accelerating. The number of people aged over 65 is projected to increase by almost 60% between 2016 and 2031. And the number over 85 will almost double. In order to meet the healthcare needs of an increasing and ageing population, the Sláintecare report on the future of healthcare recommends a decisive shift in the overall model of care away from hospital-centred care and towards care in the community. The focus of the programme for government over the next 5 years in relation to health and social care is to make the Sláintecare vision of right care at the right place at the right time a reality, and the Department of Health's work across a whole range of priorities reflects this vision. Such priorities relate to home and community care support for older people, housing, tackling loneliness, long-term residential care, dementia care, and end-of-life care. Implementing these commitments will ensure that our older people can live in their own homes with dignity and independence for as long as possible, and that they can continue to contribute to social, economic, cultural and family life in their own communities. Good data and evidence, such as the evidence generated by TILDA, are important enablers of these priority areas. The research findings in this 5th report give a picture of the older population in Ireland shortly before the arrival of COVID-19 pandemic. As well as assisting in healthcare policy, planning and delivery, the data being gathered by TILDA can help us understand the impact over the life course of different health behaviours and influences. It can also be used for designing interventions and projecting future health and social care needs. I am particularly struck by the breadth of evidence that TILDA provides, and the report covers rates of utilisation of healthcare and community services among older adults, the prevalence of numerous health conditions in the older population, and how modifiable behaviours such as exercise and smoking are associated with better or worse health outcomes. We all age, and we all have to pay particular attention to our physical, mental, and emotional health and well-being as we all get older. This research is of interest to all of us on a personal as well as on a policy level. It can show us how we are doing compared to the rest of the population, and it can give us an impetus to change behaviours that are within our power to alter, like becoming more mentally, socially, and physically active, moderating our alcohol consumption, controlling our weight, or eating more healthily. Over the years, TILDA researchers have prepared topic reports on numerous subjects of interest to policymakers across the department and indeed across government. The most recent of these, on caring and the receipt of care among TILDA participants, provides invaluable evidence that will be used by the department to inform the ongoing work on the development of the statutory scheme for the financing and regulation of home care. Based on a sustainable financing model, the aim of the new scheme is to ensure that everyone has equal access to home support on an affordable basis in accordance with their assessed care needs. As the Wave 5 report shows, older people make a huge contribution to Irish economic and social life through work, caring, volunteering, and participation in social activities. The report also shows the variety of purposes for which older adults use the internet and differences in these purposes by gender and age. The COVID-19 pandemic has been hard on everyone, but particularly on older people, many of whom have experienced loneliness and isolation through having to cocoon or being resident in nursing homes. A snapshot of the older population just prior to the COVID-19 pandemic gives a baseline which will allow us to gauge the longer term impact of the COVID-19 pandemic. It will allow researchers to identify negative impacts on health and well-being and also positive development, for example, greater resilience, development of new technological skills, or participation in new activities. I would like to acknowledge the range of reports published by the team in relation to COVID-19 that have proved and provided crucial evidence to inform the pandemic response this year and the forthcoming results of the TILDA COVID-19 survey. I understand that other speakers will bring you through the main findings of this report, and I therefore will not speak to the specific findings. Suffice to say that this report is an excellent opportunity to learn and discuss how people are living and aging in Ireland and what we can all do, including at policy, service planning and delivery levels, to improve every aspect of our health and our well-being as we all age. I would like to thank TILDA's principal investigator, Professor Roseanne Kenny, whom we've heard from, for her able leadership of TILDA since its inception, and also her research team who have worked hard to prepare this Wave 5 report from the wealth of health, economic and social data gathered in this and previous waves of TILDA. Thank you for inviting me, and I hope you find great value in this report. And could I just say on a personal note, I'd just like to wish each and every one of you a happy and peaceful Christmas, and hopefully everybody will get some family time and some downtime as we face into 2021. Gorv Míle Maith Go Léir.
Thank you very much, Minister. Thank you for a wonderful introduction. And we have next up for our first presentation, Dr. Aisling O'Halloran will take us through frailty, multimorbidity, and healthcare utilisation in the report.
Sorry, Paul, is that on the correct view there?
Yeah, if you put it on.
Put it on complete slide, Aisling.
Yeah, if I could just get to it here.
Thank you.
Thanks, Roseanne. Now, how's that? Is that better?
Perfect. We see you now, Aisling. Thank you.
Okay, thank you very much. And thank you very much to the Minister for that excellent introduction. So my name is Aisling O'Halloran and I'm a Senior Research Fellow with the TILDA study. And today I'm going to present to you just an overview of some of the key findings from 3 of the chapters from the Wave 5 TILDA report, which focuses on the older population of Ireland on the eve of the COVID-19 pandemic. So I'm going to speak to you today, firstly about frailty, then about multimorbidity and medication use in Ireland, and then finally I'll finish up with a discussion on healthcare patterns of healthcare use. So first of all, we have a chapter on living with frailty in Ireland in 2018. And just a little bit of background to explain what frailty is essentially. So frailty is a clinically recognizable state of increased vulnerability to adverse health outcomes. So these would include things like falls, lower cognitive function, disability, hospitalization, and transfers to institutional care. Frailty is not a diagnosis because frailty can be caused by different factors in different individuals. The most common ways of measuring frailty are using the physical frailty phenotype and also the frailty index. And in this report, we used the frailty index, which measures frailty as an accumulation of health problems. So the more health problems you accumulate, the frailer you become. So what did we find? So we found that the prevalence of frailty is actually quite common in Ireland and affects 1 in 6 individuals aged 58 and older, 1 in 5 individuals aged 65 and older, and 1 in 3 individuals aged 75 and older. So you can see it becomes more common with age. In addition, we found that that frailty is twice as prevalent among women as among men. You can see here 22% compared to 13%. And we also found that those with a 3rd level education were more protected against frailty and actually were 3 times less likely to be frail compared to those who had a primary school level education only. We also looked at the population of Ireland aged 58 and older who are living alone. So about 10% of the population in this age group live alone. And among those, 1 in 4 are living with frailty, while over the age of 75, 1 in 2 who are living alone also are living with frailty. Because of this, we also then decided to look at informal and formal community support services in the home, particularly among the over 75 age group, excuse me, where the prevalence of frailty is 1 in 2. And what we found is that 1 in 2, or half of individuals over the age of 75 living with frailty did not receive any informal care support or any formal community support services. 1 in 3 received informal care support from a family member or friend. 1 in 3 also received formal community support services. And finally, 1 in 6 received both informal care and formal community support services. We know that frailty is a risk factor for disability. And when we looked, we found that 51%, so just over half of adults aged 58 years and older living with frailty in Ireland were also living with a disability. We also found that people living with frailty experience lower levels of cognitive function, and this is across all age groups, from those aged 58 to 64, 65 to 74, and 75 and older. But on a positive note, when we asked individuals to rate their own physical health, so they could give a response of excellent, very good, good, fair, or poor, and this is how they perceive their own physical health, we found that 55% of those aged 75 and older who are living with frailty reported that their health was either excellent, very good, or good. And this was significantly higher than those in the younger age groups, where only 38% reported that their physical health was very excellent, very good, or good, while also living with frailty. So we can see there's a level of more positive perception at older age groups. And finally, on frailty, it's important to note that frailty is not inevitable. It can be avoided, delayed, and reversed with timely and appropriate interventions. Next, we have a chapter on multimorbidity and medication usage. So when I talk multimorbidity, what I'm talking about is the coexistence of 2 or more chronic conditions in a single individual. So it's the presence of 2 or more chronic conditions. And when we looked at multimorbidity at Wave 5 in TILDA, what we found is that just 8% of adults aged 58 and older reported having no chronic conditions at all. However, 74% in this 58 plus age group reported having 2 or more chronic conditions, while among those aged 75 and older, 64% reported having 3 or more chronic conditions. We also noted that chronic conditions, having 3 or more chronic conditions, was more prevalent among women compared to men, and that was in all age groups. But interestingly, what we found was that there was twice as high prevalence of multimorbidity among older adults who had low levels of physical activity compared to those who had high levels of physical activity. So as both Professor Kenny and the Minister referred to there, we can see here the impact of physical activity on health and multimorbidity, that it's decreasing the risk of multimorbidity significantly. When we looked at different types of conditions, first we looked at cardiovascular conditions, and what we found that was having high cholesterol was prevalent at 6 in 10 people had high cholesterol, and 5 in 10 people had hypertension, and these were the 2 most commonly reported chronic conditions. We also found that angina and heart attack both increased with age, and that diabetes increased with age, but only among men. The prevalence of diabetes remained stable among women at different age groups. We next looked at cerebrovascular conditions. So this is mainly focusing on stroke and also mini stroke or transient ischemic attack. And what we found that there was 4 times higher prevalence of stroke among those aged 75 and older compared to the younger age group, age 58 to 64. We also found that there was twice as high prevalence of mini stroke or TIA among adults, again, reporting low physical activity compared to high physical activity. So the people who had low physical activity were at twice the risk of having mini strokes or TIAs. Next, we looked at respiratory diseases such as asthma and lung disease, and we found that these are also quite prevalent. Asthma is prevalent at 13% and lung disease at 9%. We noted that more women reported having asthma in the 58 to 74 age group. And we noticed that smokers had significantly, in fact, 2 times higher prevalence of lung disease compared to past or never smokers. So again, we can see here lifestyle factors having an impact. In relation to arthritis, we found that 46% of those, so almost 1 in 2 age 58 and older, had arthritis, and this increased to 60% of adults age 75 and older. And we also noted that the prevalence of arthritis was higher among women at all ages. And in relation to cancer, we found that there was an increase in the prevalence of cancer with age in men. It increased from 6% in the 58 to 64 age group to 17% in the 75 plus age group, while the prevalence seemed to remain more stable among women across the age groups age 58 and older, increasing from 11% in the 58 to 64 group to just 13% in the 75 and older age group. In relation to medications, what we found was that in the 58 and older category, 2 in 10 people reported using no medications at all. However, 5 in 10 people in the 58 and older age group reported use of antihypertensive medications. So that's half of everyone in the TILDA cohort, essentially. In the over 75 age group, we found that 9 out of 10 individuals reported using at least 1 medication. However, 5 in 10 of those aged 75 and older reported use of 5 or more medications, and this is a condition known as polypharmacy, and this is a high-risk condition for several adverse health outcomes. Finally, we then looked at patterns of healthcare utilisation and healthcare entitlements. First, we looked at healthcare entitlements and specifically healthcare coverage. And what we found was that 36% had a medical card only. 28% had a medical card and private health insurance. 27% had private health insurance only, and 2% reported that their only cover was a GP-only card. 8% of people reported having no healthcare cover at all, either private or public. Next, we focus on healthcare services, and first GP services, and 93% reported visiting the GP at least once in the previous year. And the average number of GP visits among the TILDA cohort was 4 GP visits per year. Looking at hospital services, we found that 46% visited an outpatient clinic, 8% had a day case procedure, and 20% visited the ED. So 1 in 5 of our 58 plus age group had visited the ED in the previous year. In relation to hospital admissions, we found that 16% had an overnight hospital admission, and the length of stay increased with age. The average length of stay was 1 night in the 58 to 64 age group, but increased to an average of 4 nights in the 75 and over age group. Next, we looked at community-based healthcare services, and these were used less frequently than some of the more acute and medical services. 15% reported visiting an optician in the past year, 11% had visited the dentist, 6% visited a community physiotherapist, and 5% visited a chiropodist, and less than 3% visited each of a dietitian, hearing services, psychological or counselling services, or social work services. We also looked at home support services, and we found that the use of home support services also was less frequent and less common. 8% used an informal carer, 5% were visited by a community nurse in the past year, and 4% utilised either home help or a personal care attendant service. In addition, we looked at home modifications, and we found that 8% had reported undertaking home modifications at an average cost of just under €3,900, and 62% of these had received help from the state to cover these costs. So in summary, we see that frailty is highly prevalent and increases with advancing age in Ireland. Among those living, it's more prevalent among those living alone, those living with a disability, and those living with poorer levels of cognitive function. We also know that frailty is a high risk, living with frailty puts one in a high risk group for the adverse outcomes of COVID-19. However, on a positive note, we do make a note of the fact that older adults with frailty at older ages rate their health quite positively. In relation to multimorbidity and medication use, again, we see both of these are highly prevalent in Ireland, particularly in the over 75 age group. Again, these are a risk group in relation to COVID-19. And finally, in terms of health service use, we noticed that there was generally the health service was orientated towards acute medical rather than community support services. And that this may pose potential challenges during the COVID-19 pandemic for older adults wishing to access services due to the fact that some services have been deferred or reduced during the pandemic. So you can read more detail. This is just a brief overview of what's contained, and you can read more detail in the 3 chapters that I've just summarized in the Wave 5 report, which will be launched after this. And finally, I'd just like to thank our funders, the Department of Health, Atlantic Philanthropies, Irish Life, and also the Health Research Board, Science Foundation Ireland, the HSE, and some also funders from outside of Ireland, including the NIH in the US and the EU Horizon 2020. Thank you very much.
Thanks so much, Aisling. I think you had the hardest job of us taking us through 3 chapters. I'm going to take us now through something that's a very pertinent topic after the current pandemic, which is internet access and use among the older population in Ireland. So now, thanks again, Aisling, and welcome everybody. So we looked at, and wave 5 was the first time we looked at internet access, internet use, and the purposes of internet use among our population. And the results are quite interesting, and I think they'll provide a really interesting baseline for post-pandemic, looking at what kind of trends emerge, how people moved more online during the pandemic. So we have 80% of adults over 58, which is the baseline age of our TILDA population at the moment. We're undergoing replenishment, have access to the internet in their homes. And internet access, unsurprisingly perhaps, decreases with age. So it's at 94% between the 58 to 64 group, drops to 83%, 65 to 74, and at 75 plus, access to the internet in the home is at 58%. Now, of those with home access, 70% of older adults use the internet daily, and 87% use it at least weekly, so at least once a week. These numbers might actually seem a little bit low. I think we're so used to the internet, we figure that if you're using it at all, you would be on it every day. So only 70% of older adults accessing it daily might seem a little bit low. 30% seems high for not accessing it. 13% for less than weekly might also seem high. This may be influenced by some older adults who are living with family in a house that has internet access. They're aware that they have internet access, but perhaps they don't use it very often. So that may be one explainer for it, but it's an interesting statistic. 70% with home access doesn't seem very, very high for daily use. 83%, there is some urban and rural disparity. I think we expect this, but it's perhaps not as wide a disparity as we might think. 83% in urban areas have home access, and in rural areas, the figure is 75%. I think that's higher than a lot of people would have thought. We hear a lot about the absence of broadband in rural Ireland, and older people tend to have lower access than younger. So 75% in rural areas perhaps isn't a low number. And I think the disparity is not as wide as some might have thought. Access to smartphones and apps, similarly, so 66% of older adults have access to a smartphone or a tablet, and therefore to apps. And this similarly decreases with age. It's at 84% at the 58 to 64. It's at 69% at the 65 to 74 age cohort. And above 75, it drops to 42%. Perhaps not that low a number. I think it does show a lot of integration, comfort with the internet, I think, among older adults at 42%. Reliance on the internet outside of the home. So 3% of our participants who responded who use the internet are solely reliant on internet access external to their home. So this could be a friend's or a relative's home. It could be a library or community center, anywhere that has a public Wi-Fi network. So 3% obviously can and do use the internet, but are reliant to it external to the home. And this may, this cohort of 3% may be people who visit either children or grandchildren and use the internet then. So they know about it, they can use it, they don't feel the need to have it in their home, but when they're visiting, they will use others. We don't know exactly the profile of the cohort, but 3% are reliant on the internet external to their home. Now, one interesting statistic is access is less common, much less common among those living alone. So it's at 80% across all ages, as we saw for home access, but among those living alone, 36% don't have internet access. And I think this has major implications for social connectedness, particularly in light of the pandemic, when so many activities moved online. Those who are living alone may already, if they were advised to cocoon, have been a little bit more isolated. And at only 64% of those living alone having internet access, it does point to perhaps a need to get more older people online to reach them, to make sure that they're connected in the event that they can't go outside of their home. And a pandemic is the extreme example, but we've seen bad snows over Christmas and over winters, which have confined people to their homes in rural areas. So it's interesting to note that those living alone tend to have a higher level of no access to the internet. The most common purposes, we do see very varied purposes. There aren't really many surprises here. Searching for information is the most common purpose. Sending and receiving emails is next. Financial transactions, sometimes sounds high at 59%. We don't perhaps expect people to be that au fait with intricate financial transactions, but this would cover everything from online banking to purchasing something with your card on Amazon or paying a bill, renewing your television license. So we might expect it now to be at that level where all of those services have moved online. News, accessing news is perhaps low. I suspect this will be higher in our next wave. I suspect this will be higher after the pandemic. And I think we can all imagine that audio and video calls, which were reported by 44% of participants, will have a higher rate after the pandemic. Social media, 40% of our participants use the internet for this purpose. This seems a little bit low, I think. I think if you know the profile, if you've read of the profile of older users of Facebook, so it's interesting that we don't have a very, very high rate of social media, and it will be interesting to see what way that goes in future waves and in future data. Those who use the internet for gaming or apps are at 17% of our participants. And I'll just dig a little into the last two figures. So social media use, all uses of the internet see a decline associated with age. So fewer people at the higher age brackets, though they have the access to the internet, are using it for things like emails or financial transactions. But the largest decline by age is associated with social media. I think that's interesting. It means that we essentially have a higher bracket of age which never really got onto these platforms. And we do see that women use social media considerably more than men. 47% of women among our participants report using social media, compared to only 33% of men. Gaming and apps, we see a major gender difference here. So women use the internet for gaming and apps far more than men. And I pulled this out as an interesting statistic because when I saw it, it surprised me. I think when a lot of people think of gaming, they tend to think of it as a quite male-dominated pursuit, particularly younger males engaged in very immersive games with multiple players, using the internet to coordinate and to communicate with one another. But what our data shows is that women are using the internet more for gaming and apps than men. And it was when I consulted with a younger colleague who would know more about these things, said, these are really mobile games. These are things like Candy Crush Saga and things people play on downtime in a waiting room, on a journey on public transport, and women are engaging in this far more. And I suppose it is always encouraging to see when you see a finding in your data that surprises you, that this actually replicates international data. This is from the Pew Research Center reported by Forbes. So the percentage that play games often is much higher among younger cohorts, among males, but it flips at the age of 50, and women are playing far more games than men above 50 and at 65 plus. And another statistic suggests that about 79% of purchases made in game, so a lot of these apps that you play with, you can unlock certain features by subscribing and paying a fee, and about 79% of the money made by those are paid by female gamers across all ages. So women are engaging far more with games and apps associated with gaming online at the moment, and it'll be interesting to see whether and how that might change in the future. Just what trends can we expect? I think this will not surprise anyone, I'm speculating here, but having gone through what we've all gone through since March, we have this phrase, I've pulled one Telegraph headline, but I've heard this often, the baby Zoomers. So we know that older people are going online far more, they have upskilled, they've acquired new technological skills because of the pandemic. I suspect we will see a post-pandemic increase in the use of the internet for all purposes that I've listed, and perhaps a much higher use across all age cohorts among the older population. This is something you would see anyway, some kind of increase in percentages across cohorts as people age, because you'll just see the progression of the proportional higher usage as people age. But I think we will also see a measurable impact of the pandemic on the access and the use and the nous and know-how associated with technology. And this will be measurable, I think, in future TILDA data collection, also in Census 2022. It's been pushed out by a year because of the pandemic, but this does have a question covering home access and covering the purposes, and the CSO conduct regular sub-surveys in intercensal years. So we'll be able to measure this with TILDA and other sources to see how the access rates and purposes change in the future. and we'll be able to see what of that is attributable to what we've all gone through in the pandemic. So in a general summary, internet access is common and the usage is frequent and for varied purposes. A majority of older adults has access to a smartphone or to a tablet. We've seen there are notably higher rates of lack of access among those living alone, and this is something I think with implications for policymakers or perhaps for commercial providers if they can market it correctly. We don't know if that's associated with the cost of internet. It's something that would be interesting to look into. The use of all purposes or for all purposes declines as age increases. Information searching and emails are the most common purposes of internet use. I think this would probably be replicated across all age groups, but it's certainly emphatically there among our cohort. And women are more likely to use the internet for gaming and apps and for social media. These were where the most emphatic gender differences were. I think financial transactions, for example, men were using it more by only about 1%. It was very similar across most uses, but the really striking differences emerged in these two particular ones, social media and gaming and apps. And I just want to acknowledge the other authors of this chapter, which again, you can read in our report, which will be online after this launch. So Paul Doody and Minjawan Wang, who are the lead authors, Siobhan Scarlett, Anne Heaver, and myself. And again, as with Aisling, I want to acknowledge our core funders over the course of the study, the Department of Health, the Atlantic Philanthropies and Irish Life, and our additional funders who have all chipped in over the course of our study. So thank you very much. And next up, we're going to have Christine McGarrigle, who will take us through the contributions of older adults to Irish society. Christine.
Thanks, Paul. I'm just going to share my screen. And can you see that?
Not yet, Christine.
I'm going to have to stop that again, hold on. There we go.
Yep. Go to your presentation, just, yeah.
Is that on presentation form now?
We've got you now, Christine. Yeah.
Great. Okay, thank you. Yeah, so I'm Christine McGarrigle. I'm a research fellow at TILDA. And I'm going to present today. In previous research, we've shown the range of contributions that older people have made in Ireland through providing both resources to their families and to their and to community through volunteering, active participation in society. And what we want to do really is just to take this opportunity to once again underscore the importance of the contribution that they make to society in Ireland and in general to the country's economic well-being, either directly or indirectly by enabling others to take part in the workforce through their volunteering and caring. I'm also going to highlight some of the challenges current COVID-19 restrictions may pose for informal family caring and for childcare, for working parents who've previously relied on grandparents to provide affordable childcare options, enabling mothers in particular to remain in the workforce. So TILDA asks a number of questions about care of participants towards different people in their families and relatives. We ask about help provided to parents and relatives with tasks like dressing, bathing, eating, or household tasks. And we also then ask whether they helped their neighbours or friends with household tasks. Household tasks in this case would include things like help with housework, shopping, filling in forms, etc. And what we find is that overall, 37% of adults aged 58 years and older, that's 39% of men and 35% of women, provide some kind of regular help and or care to their spouses, relatives, neighbours and friends. And this tends to take the two forms. The majority provide help with household chores for relatives, friends and neighbours, but others do provide care with those activities of daily living also. When we look at the numbers who provide care, overall, When we add those groups together, 1 in 2, or 50% of men and 49% of women report that they have provided help or care to family, friends, and neighbours in the past month. This decreases with age. We see it's 44% of men and 37% of women in the 65 to 74-year-old age group, and 20% and 19% of those aged 75 years or older. So still substantial at 1 in 5. But we also asked specifically about whether or not people provided care in the past month. And so this gives us an idea of the informal care or family care taken, provided by the older generation. And we also asked them for how many hours. And what we see is that overall, 5% of men and 7% of women report that they had provided informal care for a family member or friend in the past month. So that equates to 68,000 individuals. The proportion was similar for men and women. There is some age differences. When we identified the recipients of the care that was provided, what we can see here is that for men, 32% reported it was their spouse, and for women that was slightly less. When we look at the other people who also received care, what we see is that 20% and 13% of women report that they looked after grandchildren, 26% of men and 37% of women report that it was another relative, and a further 8% of men and 12% of women report that the main person who they provided care for was a friend or a neighbour. And if we look at that in a little bit more detail, we see this would be who those other relatives might be. 8% of our cohort aged 58 years and older still have living parents. And of those, we can see that 12% of men, right up to the age of 74, report that they provided help with dressing, feeding, and bathing to their parents. And these proportions were higher for women, 21% of women aged 58 to 64, and a third of women aged 65 to 74. And then we also see that it's almost 1 in 2 who have living parents regularly helped them with household chores and tasks. So when we look at those other household activities that they were helping with, overall 8% of men and 7% of women report that they helped children with household tasks. And the figures here show that this did increase over age, while women, the same proportion, report that they helped their children right up to the age of 74. For men, we see this increase in the 65 to 74-year-old age group. So what we're seeing here really is that the effect of retirement. So once men do retire, they have more time free, and that time is spent helping. Here specifically, we can see with their children. And it does decrease over time, but there's still a substantial number. We see that 14% of men and 12% of women aged 58 to 64 helped with their friends or neighbors, and that remained the same up to the 64 or the 74-year-old age group. And while it was still lower over 75, it was substantial at 8%, providing help to their friends and neighbors. So we've always seen this, and it continues. A substantial number of the over 58-year-olds report that they've looked after grandchildren in the last month. It's 42% overall. We see a little decline in the 75-year age group. But what is, again, notable is that while this proportion remained the same for women, it was 50% in the 58 to 64-year-old age group and 54% in the 64 to 70 or 65 to 74-year-old age group. For men, we see this increase again from 40% of men aged 58 to 64 to 54% of men aged 65 to 74. So again, we're seeing this effect of retirement and increased helping out of the family. Ireland is one of the highest volunteering in the European Union. And this work has many benefits. Obviously, it benefits all of the people in the country who have this volunteering carried out for them, but also it helps the volunteers themselves. And evidence suggests that volunteers have better physical, mental health well-being, as well as an overall better quality of life. And so what we see in wave 5 was that 1 in 5 adults aged 58 years and over reported that they volunteered in the last month. That's remains similar. It's roughly about a quarter right up to the age of 75, and then 16% of men and 13% of women aged 75 plus still report that they volunteered in the past month. We were interested to understand why people were reporting volunteering. And when we asked, what we found was, not surprisingly, I guess, the most common reason people gave for volunteering was because they enjoyed it. And that was for 28% of men and 41% of women. The second most common reason was so that they could use their skills. And that was 23%. And then other reasons included so they could contribute something useful, because I'm needed to keep fit, and because I feel obliged to. So what we can see here really is that most of the reasons for volunteering are very altruistic. So people aged 58 years and older still continue to live active social lives. Overall, 90% reported that they participated in active social activities, while 72% also reported that they participated in organizations, and these include things such as sports groups, charitable organizations. The figures were very similar for men and women, and these activities provide a means for people to maintain their friendships, pastimes, and generally remain engaged. Participation in social and leisure activities has many benefits for health as well. We understand this. It's associated with better physical and mental health, and also improved cognition. And so what we did see in addition was that people also maintained quite large social networks. 1 in 5 had 4 more regular social contacts. And certainly social networks can be maintained through participation in organizations and attendance of religious services. And these are the most common means that we can see that people are maintaining these their social networks and social groups. So to conclude, we've demonstrated that far from the later years been characterized by a decline or dependency, older people in Ireland continue to make valuable contributions to society, with many characterized by active citizenship and participation in the lives of their families and their communities. TILDA is very well placed to review the impact of COVID and policies on the older population. And in particular, just to stress that because caring for grandchildren and volunteering may not be taking place at the same scale because of recent physical distance restrictions due to COVID, support structures and assistance will be needed for families and communities who rely on the older generation to provide care. And just to stress, in particular, the lack of childcare for working families normally provided by grandparents may also really exacerbate the inequalities in the economic impact of the pandemic, as those who are most financially dependent on informal and family support will be disproportionately affected. Similarly, frontline and essential workers who've continued going out to work during the pandemic won't have these family supports for childcare and household help that's normally available to them. So I'd just like to finish there, and also, as with Paul and Aisling, thank our core funders and all our additional funders, and any other information can be accessed on the TILDA website. Thank you.
Thanks so much, Christine. Very important and appropriate topic in which to close our presentations. Thanks everyone for attending. I'm just going to revert to Professor Kenny for some closing remarks before we finish.
Thank you very much. And thank you to all of our presenters who were wonderful, of course, and to the whole team who's contributed to this. This isn't a one man or even a one woman show. We've a large, really active team. So thank you to all of you. One message I take from this and that I would like to share is heterogeneity. Lumping everybody together as older persons over the age of 58 is not appropriate. And going forward, one of the tasks that we will sort is how you actually disaggregate chronological age, i.e. your number 58, 60, 65, 75, 80 from your biological aging, because no two 83-year-olds are the same. One may be incredibly infirm and frail in longitudinal care and another running a marathon, yet their number, their chronological age is the same. So it's behoven on us to try and sort this out so that when we're referring to individuals, we are detailing their phenotype in such a way that we can better understand their needs, as well as, of course, their contribution. Everybody contributes, irrespective of frailty, but needs is what we're about in the context of policy and identifying where best to place very limited resources. A 58-year-old, when they were born in 1962, you know, Bob Dylan was #1 in the charts. I just looked this up. An 80-year-old born in 1940, a very young Bing Crosby was coming onto the scene. So there's no way that those two cohorts have had the same life experiences or the same life course that has driven their biological aging, and their chronology, the number, is irrelevant. So that's the first thing I would take from that. We're going into the field in January 2021 with a very novel salivary method for measuring antibodies, not just COVID antibody, but antibodies to various viral exposures. And we're asking our participants to engage with us again acutely and intensely during that period of time, hopefully in advance of getting a vaccination, so that we get their baseline antibodies and we know truly who has been exposed and experienced the infection and what their biology has done to respond to that, how it has communicated with the rest of the organ in order to either render that person asymptomatic despite being infected, irrespective of age, or symptomatic, etc. So that's our January task. And in 2021, for that year, we're going into the field again, collecting wave 6 data. So a whole lot of data coming down the track. This morning's presentations, this morning's report will form the baseline with which we will make really valuable comparisons with the experience of COVID and life, hopefully, soon after COVID. So thank you very much to the Minister for sharing her time with us this morning. Very much appreciated. Thank you once again to the great TILDA team that we have, and for their excellence, resourcefulness and resilience. And thank you most of all to our participants, without whom we have nothing. And they give so much to Ireland and to younger people in Ireland because of their generosity. Have a very happy Christmas, everybody, and we'll see you again soon. Thank you.